Hi, my name is Amara Wong, and I will be the moderator for this workshop titled Spectrum of Elder Care Services, and Martin Lee is our tech support. I wanted to welcome all of you to this fourth workshop. If you have missed any workshop in the morning or even yesterday, no worries. They have been recorded and will be posted on our website, the Family Life Ministry website next week. We also just want to kind of let you know that yesterday we had a wonderful time with Dr. Chai, the main speaker, and she went over the essential tips for maintaining health as we age and the different changes that we go through. So it was a wonderful message and sharing that she had. Great PowerPoint, and also we also have a panel discussion with Dr. Chai, social worker Melody Lin, and psychiatrist Dr. John Xie. So if you have missed that, I will recommend that you go to the website and listen to that day. This afternoon, it is my pleasure to welcome Dr. Chai back to share with us on the elder care services. For those who have missed her introduction last evening and this morning, let me give you a quick intro of her background before letting her take over the meeting. Dr. Chai is a geriatrician from Baltimore, Maryland. She serves as a medical director and attending physician at 2 rehab and skilled nursing facilities. She completed internal medicine residency and chief residency in quality improvement and patient safety at Baylor College of Medicine. She completed additional training in geriatrics fellowship at Johns Hopkins University. Currently, she also assists in teaching Johns Hopkins geriatric medicines fellows. So I would like to welcome Dr. Chai again, and Dr. Chai, just take the floor, and we are just eager to learn what you got to share with us.
All right, thank you, Amara. We'll start the share screening. Okay, can everyone see my PowerPoint?
Yes.
Great. All right, so good afternoon, everyone, and thank you for joining us for this afternoon talk. So in this talk, I will be giving you an overview of common health services that are available to our elderly. I will start with a quick Zoom poll as well in this session, just to get an idea of the audience. Martin, would you be able to launch the Zoom poll? All right, great. And just to be note, the first option A, I changed the answer to current or former caregiver. It's not in the Zoom poll, but it's on the slide. So current or former caregiver for option A. All right, I think just a few more seconds. All right, so I think I'll end my poll right here and share the results. So very interesting. So about 36% of us are current or former caregiver of the elderly individual. Looks like one person may have their own health issues, and majority of us are healthy. That's great. So I will now get on to my talk. All right, again, I have 3 main objectives for this talk. First, I'll be giving you a brief overview of the different spectrum of health services that are available for the elderly. Second, I will be discussing the various resources available for you to age at home. And third, I will give you an overview of the differences between the senior living communities, rehab facilities, and nursing homes. So first, I wanted to start with this picture of the different levels of needs. So depending on one's health status and medical conditions, our older adults can have various different level of needs. So on the first picture on the left, you see a picture of relatively healthy, robust adults who are exercising. So they are likely able to live by themselves and independently able to function. In the middle picture, we see someone who is using a walker, and she looks like she could be a little bit more frail. So she likely will need a little bit more assistance in her healthcare needs. And on the third picture on the right, we see someone who is more older, who's more frail and maybe disabled, maybe bedbound. And she will likely need a lot more care services, and she may even need 24 hours assistance. So really depending on the older adults' functional level and their different level of needs, they will also need different levels of health care services. This is a nice graph that gives you a brief overview of the different spectrum of health services available out there. So on the y-axis, it goes from robust on the top to chronic diseases, multiple chronic diseases, and then down here is more frail, disabled, and becoming dependent. And then on the right, there's two sections of the graph. One is outpatient and one's inpatient. So on the outpatient side, for healthy adults, you probably just need to go to an outpatient clinic once in a while to get a checkup to stay healthy. If you develop more chronic diseases though, or multiple chronic diseases, that's maybe when you can be helpful to get a geriatric assessment or see a geriatrician who can better help your manage your multiple chronic illnesses. And as you get more frail and maybe you become housebound, that it's really difficult for you to go to the clinic appointments. You may benefit from something we call house call programs, where the doctors can go to your home to assess you instead of you going to them in their clinics. Along with that, there's also home health services available. So they can include home health nurses or aides that can come to your home as well. There's also something that's more developed in called home hospitals or hospitals at home. It's still not very common yet. It's basically when you're acutely sick, that instead of going to like a big hospital, you stay at home and they bring the hospital services to you. Still in development and not very common yet. And I don't believe we have that in Houston yet. So more on the inpatient side, as I said, when you get sick, right now you just go to the hospital. They take care of you acutely in the hospital. For some folks who have multiple chronic diseases, sometimes even after the hospitalization, they would still require more time to get better. And some of them are recommended to go to an inpatient rehab or nursing facility for a while until they get stronger before they would go home. Some of them may have chronic wounds that will need better wound care that can be taken care of at rehab as well. As the older adult gets more frail or more disabled, and they need 24-hour nursing assistance, that's when they maybe need to be considered to go into a nursing home or skilled nursing facilities. And if they become severely disabled or dependent, or if they're on a ventilator for a long time, they may need to be considered for what they call long-term care hospitals, where they have a little bit more resources to take care of those patients. So we'll kind of keep this picture in mind as we talk about various different resources available. Next, so I will be talking about many different resources for older adults to be able to age in place. That means they will stay in their home as they get older, though they may have different concerns about their safety or other daily activities, and they may need more resources for them to be able to stay at home safely. So not to our surprise, most seniors do want to age in place. So according to a survey done by the American Association of Retired Persons in 2018, about 76% of adults age 50 and older want to remain in their current homes. And about 77% of adults age 50 and older want to live in their current communities. But is aging in place really a right choice for you? So we have to think about, is it safe for the senior to live at home, given their own kind of medical conditions? And the home itself needs to be able to meet the needs of this person. Generally, they may be a right choice if they have a strong connection to the current community. They have a very strong support network, including family or friends that live close to you. And your home maybe has universal design or is modified in a way that's safe and accessible for you. And also you may need additional resources to be able to hire home care aides if needed. And you still have to be healthy enough to not really need kind of 24-hour assistance to be at home. Generally for aging, a senior living community may be better if don't have as much of a strong support network of people who can do. You want to live in more of a social community with opportunities to meet friends and make friends very easily. And you will benefit from always having someone nearby with some professional expertise who can help you. So Elder Care Locator is a website that's provided by the U.S. Administration on Aging. It's a great website for finding resources in your community to connect you to the resources for older adults and families. You just have to enter the zip code on the website to be able to find a list of these resources. The local area agency on aging is also a great resource for you to find out more kind of local senior resources. So Harris County have their own area agency on aging, and is part of a national kind of network of agencies. They provide a number of different services for older adults, many specifically to help the older adults to live at home. And they also provide resources as well for caregivers. So this is an example of resources that provide from their websites. So you can see it's many different resources, and many of these services are actually free. So if you want to find out more about local resources, definitely reach out to them. All right, so as we're discussing more aging at home, again, I want to emphasize home safety, which is essential for them to be able to stay at home. So most homes are actually not built to support the physical changes that may come with aging. And so you may need to consider home modifications that may be necessary in order to accommodate some of your changes. Fall prevention is also key in your home environment to keep you safe. And there's actually home safety assessments that can be done by occupational therapists. They're usually part of a home healthcare program where the occupational therapist comes to your home. They look at the different aspects of the environment of your home to see how safe it is. And they can also make recommendations for changes to your home. The infographic on the right is from the National Institute on Aging. It has some simple suggestions such as don't use these kind of small area rugs because they are a fall like tripping hazard. Make sure you have some grab bars in the bathroom near the toilets or in the shower, because that's again an area of high like fall risk when the floor is slippery. And there are other kind of little suggestions like installing light switches at the top and bottom of stairs and have some night lights in case you get up in the middle of the night. This is another kind of helpful checklist from the CDC home fall prevention checklist. Just kind of things to think about around the house that you may want to modify to prevent falls at home. Things to think about, simple things you can make changes to in your house. All right, and next I want to talk about home health care. So home health care is a service. It's a short-term intermittent skilled nursing care and therapy service They consist of a team of home health nurses, therapists, and that include physical, occupational, and speech therapists. And they can also include a home health aide. It's typically reserved for residents who are homebound, meaning that you're unable to leave the home without considerable effort or without the aid of another person or like a mobility device. And typically the homebound resident is recovering from a serious illness and they're not back to their baseline functional status yet. And Medicare actually pays for this service. Medicare Part A pays 100% cost of the covered home health care. And Medicare defines intermittent skilled nursing care as fewer than 7 days a week. And it can be daily for less than 8 hours each day for up to 21 days. And Medicare does cover home health aid when you're getting home health care, but they don't pay for the home health aid unless you're also getting the therapy and other skilled care. Other thing is Medicare doesn't pay for 24 hours a day care. They also don't pay for homemaker services like laundry, shopping, or cleaning. The home health care is an order or certification that needs to come from a physician. Usually it can be a primary care doctor or a doctor in the hospital if you were hospitalized. The physician needs to recertify it every 60 days. There's actually no limit on the number of visits to your home for which Medicare will pay. But the trick is the physician needs to certify that you have a continued need for home health care. And once you reach a certain plateau, like the therapist feel like you're not progressing anymore with therapy and this is your baseline, then Medicare is not going to pay for it anymore. Next, I also want to talk about home health aides. So home health aides are also called certified nursing assistants. They help the seniors with different activities of daily living and personal care. So they help with grooming, like bathing, toileting. Sometimes they help with cooking as well. They cannot provide medical care though, and they're actually not allowed to administer the medication unless they're also certified as a medication aid. But they are allowed to just give reminders for taking the pills, but again, they just can't hand you the pills themselves. They're also not like house cleaners. Though they can do a little bit of light housekeeping, they're not responsible for like really cleaning your house. Generally, the home health aides are not covered by Medicare. Unless, again, I said, if you're also getting some kind of skilled nursing or home therapy services that's already paid by Medicare. You may have to pay for home health aid out of pocket. And on average, they're not cheap. They're average $22 to $25 an hour. If you need more financial assistance, there is a program through Medicaid. It's called the Medicaid Home and Community-Based Service Waiver. This is a waiver that's designed to help people who prefer to get long-term care services at home rather than in a facility. So, and in some cases, when you get this waiver, the Medicaid actually pays for family members to serve as in-home caregivers. The eligibility for this Medicaid waiver is based on the income and certain asset limits. Some long-term care insurance may also help pay for home health aides, depending on the insurance. And there's a variety of VA programs that pays for it as well. Some other resources for hiring in-home help. Generally, we hire people through home care agencies or private hire. So for home care agencies, you can actually look for a list of home care agencies through the Texas Long-Term Care Provider Search website, which is listed here. Medicare.gov also has a home health compare website where they list the home health agencies based on zip codes, and they indicate their quality measures, like how quality of a place it is. Care.com and A Place for Mom also have hire. They can also have caregivers for hire as well. And I've had patients who have good success through those websites. Now, if you're thinking about more private hire caregivers, you may be able to find them through local nursing programs, through community college home health aide or certified nursing assistant programs. So they can be new grads or students who you may be able to hire privately. Next, let's talk about adult day centers. These are centers that provide coordinated programs of services for adults in more of a community-based group setting. They operate mostly during normal business hours, 5 days a week. They generally provide transportation. They do door-to-door pickup transport. They provide coordinated social activities for group settings. They also generally provide a meal and can provide snacks. They can also provide personal care. They have aides there who can help with toileting, grooming, sometimes even bathing. And they also provide therapeutic activities. About 50% of adult day centers have physical therapists, occupational therapists, or speech therapists who can offer those therapy for older adults. And then about 80% of these adult day centers also have like a nursing professional staff who's available. For finding adult day centers, you can try checking out this website. The Adult Daycare Association of Texas has a list of databases of different adult day centers. The National Adult Day Services Association also has a different list. And you can also, I guess, just Google or try to find them online as well. Generally, adult day centers are paid out of pocket. But if you do need additional payment assistance, some of the Medicaid services like the Medicaid waiver I talked about can cover some costs of adult day center. It can be part of the VA benefit, and certain long-term care insurance would cover this as well. All right, transportation. Transportation is key for helping older adults to maintain their independence and able to get to the services that they need. So there is no specific upper limit for driving, but as we age, our physical changes may still limit our driving abilities. And you may need to get more mobility device friendly vehicles or accessible vehicles that can accommodate a wheelchair, a scooter, or other mobility device. As you can also get a driving assessment done by an occupational therapist. This is a picture example of that. So this is an occupational therapist with an older adult. They do kind of a simulation driving to see if you have good response times, if you're able to read the road signs and things like that to assess whether it's safe for you to be on the road. Another option for transportation is simply the public transit. They're able to take the bus. And if they have a lot of disabilities, they can also apply to get the paratransit. For example, in Houston, it's called MetroLift. It's provided for certain eligible individuals with disabilities who cannot board, ride on the fixed route buses. It's still a shared ride service, and usually you need a doctor's signature or on the application to say that you really do need this extra kind of transport service. If you do have Medicaid, Medicaid also provides transportation for medical services as well through the Medicaid non-emergency medical transport. Next, respite care. So respite care is a short-term relief or respite care service that's provided for family caregivers who take care of a person with disability. It can be provided at home, in a healthcare facility, or adult days program. Usually you have to enroll your older adult into that program. And then you discuss payments with them, how long you want them to stay there, so that the caregiver themselves can take some time off. You can find a database of respite care programs through the National Respite Network, which is listed here. And generally it's paid out of pocket. But if you have Medicare and you're in the older adult is in hospice, Medicare does cover the cost for respite care for up to 5 days in a year. And if you have the Medicaid waiver that I mentioned before, they also cover some cost of respite as well. The VA can also cover the respite and certain long-term care insurance as well. All right, next I'll be moving on to talking about more senior living communities. First, let's talk about independent living. This is what we typically think of as retirement communities. They are residential communities that offer housing only to those age 55 plus. It can be a variety of different types of living situations. It can be your private apartment, townhomes, or even condos. Generally in these communities, they provide housekeeping, they provide linen service, some dining plans. They can provide transportation services for shopping or for medical doctor's appointments. And they provide security service as well. They generally in the community, they have some kind of shared amenity, such as fitness centers, dining venues, and different entertainment spaces. They also offer a variety of different wellness programs and activities for older adults. And personal care homes. This is kind of the next level of care. So these are private residential homes. They're generally smaller than assisted living facilities. They do provide room and meals. They have staff there who can remind older adults to take medications. Mainly the extra support they give you instead of that they don't give you independent living is that in personal care homes, they have staff who can assist or supervise activities of daily living, also known as ADLs. These are activities like washing, grooming, going to the toilet, dressing, feeding, or transferring from place to place. They also provide assistance with instrumental activities of daily living or IADLs. These are activities like housekeeping, laundry, transportation, or shopping. Depending on the size of the personal care home, they may resemble a little bit more like family life. It's often hosted in like a private residential house. They will not have medical staff available at all times, generally, but a lot of times the owners of personal care homes are licensed nurses themselves, so they can still be available, but they may not be available at all times. If the personal care home has 3 or fewer residents, they generally don't need a license. Otherwise, the bigger personal care homes are required to get a license in Texas. And you can find a list of these licensed personal care homes on like one of the Texas government websites. So the cost for personal care homes can vary depending on how nice it is, how much service they provide. On average, the monthly fees are $1,500 to $4,500 a month. And usually you have to pay out of pocket for these, but some homes do take Medicaid, but they generally have a very long waiting list. Now, assisted living facilities. These are group living spaces that provide some level of in-home support services for ADLs or IADLs. So there's many different types of facilities. They can be private apartments where you have your own room, your own apartments, or it can be more of a dormitory kind of living space, like a shared living space. They can also provide more of a specialty service, such as memory care for folks who have dementia and at risk for wandering or getting lost. They do not have continuous nursing care, but they are also licensed and regulated by the states as well. On average, they are expensive. They're about like $4,300 a month, depending on, again, how nice or how new the facility is, how trained the staff are. It's always a good idea to visit assisted living facilities in person before you choose them, because again, there's so much variabilities in how they're run, you know, how many residents each staff can take and things like that. You can find a list of assisted living facilities in Texas through the Texas Long-Term Care Provider Search website. Next level up is the Continuing Care Retirement Communities, or CCRCs. There are a community, or usually located in a single campus. They provide progressive levels of care. So they allow the residents to move from one level of care to the next as their health needs change. In general, CCRCs include living space for independent living. For assisted living, generally they include a memory care area as well. And they also have skilled nursing or nursing home care. They generally have really nice amenities for fitness centers, game rooms, dining venues. They also generally offer different social activities and wellness classes for their residents. It can be very expensive. The average entrance fee for CCRC is about $329,000. A portion of this entrance fee may be refundable in the future. They also have a monthly service fee that really varies depending on how much assistance is needed, what kind of living space you have. But the monthly fee would cover the meals, utilities, the classes, the outings, maintenance, and other expenses. Next, let's move on to talk about rehab and nursing homes. So an inpatient rehab facility, this is a rehab hospital or part of a hospital that provides intensive rehab to inpatients. So for example, Tier Memorial Hermann is a very well-known rehab hospital. It's an inpatient rehab facility. It's very commonly recommended for patients who have had stroke, hip fracture, amputation, or brain injury. The caveat is that these patients who had these symptoms, they must be able to tolerate at least 3 hours of therapy a day. That includes physical therapy, occupational therapy, or speech therapy. And they have to do it at least 5 days a week. In these inpatient rehab facilities, we have a medical team consisting of a physical medicine and rehab doctor, a nurse practitioner, or physician assistants. They are required to see the patients at least 3 times a week, and they will always be available to the nurse by phone if needed. And the payments for inpatient rehab is covered by Medicare. So in days 1 to 60 of rehab, there's a around $1,500 deductible. But oftentimes they're going into inpatient rehab from a hospitalization. And if you already pay your deductible for your hospitalization within 60 days, then you already pay the deductible and the rehab stay is free or covered by Medicare. In days 61 to 90 in the inpatient rehab, you have to co-insurance to pay, and 91 and beyond, you have to pay a higher co-insurance for each lifetime reserve days, which there's up to 60 lifetime reserve days. And then after you used up all your reserve days, then the rest of the care, you have to pay all of the costs. Generally, if you're not able to meet the rehab like requirements in inpatient rehab facilities, like 3 hours a day, then you'll move on to the next level of rehab, which is subacute rehab. So subacute rehab generally is housed in a skilled nursing facility, which is also part of a nursing home. So it can be confusing for people when they say they're going to a skilled nursing facility. Well, if they're there short term for rehab, they can just be there for a few weeks. But the reality is some of these rehab patients, they don't do well, even though they're getting rehab. They may end up needing nursing home care, and a lot of times they may need to stay in the facility for nursing home. So again, it's recommended for some patients after discharge from inpatient hospital stay who needs daily skilled care. And these facilities, they provide 24/7 nursing care. They have skilled nurses who can provide wound care or certain IV antibiotics, medication administrations. They have therapists with physical therapy, occupational therapy, and speech therapist. And the therapist sees a patient about 1 to 2 hours of therapy per weekday. So, it's a lot less than the inpatient rehab would give, but sometimes that is just how much the older adult is able to tolerate. We also have a medical team consisting of a physician, nurse practitioner, or physician assistant. And I'm part of this medical team as I go to a skilled nursing facility myself. And I would say that the physician or providers, they're not always on site. Like in the hospital, the doctor's always there, not in subacute rehab. The physician is generally there once or twice a week. Sometimes they're more often than that, depending on how many patients they have. But they're always available by phone if the nurses have any acute needs for physician to assess over the phone. That may be a good question for you to ask when you're thinking about where to send your loved ones. You can ask them, how often do the physicians come to the facility? Do they use mostly a nurse practitioner or physician assistant, or do the physician themselves see the patient themselves? Medicare does pay for subacute rehab. They pay up to 100 days of care per benefit period. So for the first 20 days, it's fully covered by Medicare. You don't have any co-insurance. And then days 21 to 100, you have to pay up to $194 a day of co-insurance. Then days 101 and beyond, the patient and the family have to be responsible for all the costs. Next, moving on to nursing homes. They're also known as long-term care facilities. This is typically the last option for people who can no longer for them to be safely cared at home, or even in like assisted living or community-based facility. It's also for individuals who need 24/7 nursing care for them to assist with activities, daily living, and personal care. Long-term care facilities also have therapists available at all during the weekdays. So physical therapists, occupational therapists, speech therapists. They will be offered to individuals who may benefit from therapy. They will also have different social activities for the adults to do. That can be different music programs, board games, bingo, etc. There's also a medical team that goes to the nursing home. They do regular visits about monthly, once a month, to the long-term care residents. And they can see the patients more frequently than that, depending on if there's an urgent need for them to see them sooner. The cost for nursing home is quite variable depending on the nursing home. But in general, they're on the median price is about $8,000 to $9,000 a month. The payment first, you can pay out of pocket. There are certain long-term care insurance that will cover nursing homes. If you spend down your assets, you may also qualify for Medicaid, and Medicaid would pay for qualified patients for their nursing home care. A good way to compare skilled nursing facility and nursing homes are through the Medicare.gov website. It's called Care Compare. So you just go to the website, enter your zip code, and you can select a variety of different provider types. So for example, if you're interested in nursing homes, you can select nursing homes. If you're interested in looking up home health services, you can select that as well. They also rate different hospice care and inpatient rehab facilities. So once you select your zip code, the provider type, you will get a list of the facilities in those zip code. And the Medicare Compare website also gives you a rating. Generally, the nursing homes are rated on a 5-star rating, and they're required to be assessed by the state every year. But during the pandemic, there was a little bit pause on the assessments, but now it's been back on full swings. So the nursing homes are all rated on the scale of 5 stars, and they rate them on different categories of health inspection, staffing, and quality measures. So these are all public information, and you can actually click on the inspection results to look at the specific details of why they were given. For example, this facility 4 stars. Look at the staffing ratio and see how this facility is compared to other facilities. You can look at their quality, different quality measures, infection rate, vaccination rate, things like that, and see exactly how they compare to other facilities. So this is a good way when you're not sure where your loved one should go for rehab for a short period or for nursing home for a long period. a good way to kind of assess a general idea of how good the facility is. Now, I would say that this star rating is not everything. There can be facilities that are 5-star on the rating, but still run poorly. So you still have to go see the facility yourself to see really how it is. But at least this gives you a good general idea. Lastly, I just wanted to give a shout out to all of the caregivers. I'm very thankful for all the caregivers, whether they're at home taking care of their loved ones or at a facility. Caregiving is very difficult work. And for all of them do all the compassion and empathy they show to our older adults, I'm really, really thankful for them. So I have a few key takeaway points. So first, depending on the older adult's functional status and medical needs, they may require different level of health services. And most older adults, they want to age at home. And there are many different resources available to help them stay at home. There are different senior living communities, rehab and nursing homes that can provide different levels of care, as we talked about. And the cost for them is very variable depending on the facility. All right, and that's all I have for my presentation. Happy to take any questions.
Thanks, Dr. Chai. That's a lot of good information for us. I just want to kick off the question, maybe help, to kind of like get started with all the questions that people might have as they kind of think through. But one thing that you mentioned about is home safety. That the occupational therapist can conduct home safety assessment. So is this going to be covered by Medicare or is it out of pocket?
They can be covered by Medicare. It's considered a home health care service. So usually it's provided by a home health care agency, like the occupational therapist works for a home health care agency. And the assessment itself should be able to be covered by Medicare.
Okay.
But you do need a referral from the doctor.
Okay. There's a question online. When you say Medicare will pay for various services, how does this work if the person is on Medicare Advantage plan and not on original Medicare?
Yeah, Medicare Advantage plan pays for the services as well. But they are a little bit more stringent than original Medicare, meaning they're like as soon as you're not meeting, like as soon as you plateau on your function with the therapist, they stop the therapy or they stop paying for the therapy. So they're a little bit more cost conscious and they can cut the service more earlier compared to original Medicare is a little bit more lenient. They're not as strict. But Medicare Advantage, I mean, overall still a good insurance. They're a little bit more stringent because they look at the days that you get the therapy and they can cut it off earlier.
Another question I have is for the transportation assessment, as we're concerned about the elderly, at what age, at what point they need to stop driving. And you mentioned about that they can be actually assessed by occupational therapists. Is that need to be ordered by the doctor, or you can just call any occupational therapist and say, hey, I want my dad to be assessed?
They generally want to order a referral as well for driving assessment. But you can certainly, not all the occupational therapists do the assessment. They generally have to be done in like a special center. So you can look up driving assessment, occupational therapy, Houston, and see if there's programs in Houston that offer it.
All right.
So not all the OTs do it.
Okay.
Any other questions?
Fanny, can I ask if the doctor can order the travel assessment, or can the doctor just order just prescribe it so that the services can be granted?
Yeah, so they can just provide a generic order for OT driving assessment. Yeah.
Thank you.
But I have a friend who's more than 90 years old. every year he just went through the driver's license prior to renew his driver license. So it's not necessarily everyone needs to be driving assessment. Is that correct?
Yeah, no, not everyone needs it. Only if yourself have concerns or your family members have concerns. Usually it's family members, but themselves, they usually don't think there's a problem. But if a family member is concerned or children is concerned, that's usually when they get driving assessments.
When you mentioned about Medicare, they have advantage and they have like a plan D, plan G or something like that.
Mhm.
Can you comment about its advantage and disadvantage? Versus those two plans.
So the Medicare supplement. So original Medicare Part A and B, that's generally provided for free for retired folks who are older than age 65. And that covers all of your inpatient hospitalizations and also covers like the rehab, inpatient rehab and subacute rehabs. They do not cover for medications though. So you will have to pay for the medications yourself unless you get the medication supplement, the Medicare Part D, which covers, which gives you some drug medication coverage. And then Medicare Advantage is kind of a separate set of plans, usually done through one of the major insurance companies. So they're kind of like a private side of Medicare. The government, instead of getting Medicare directly through the government is paying the private insurance themselves, who are supposed to provide kind of similar Medicare coverage through the private insurance. The idea is that the private insurance may be able to run the insurance a little bit better. And there's maybe some truth to that. But as I said before, the Medicare Advantage plans, because they're run by private companies, they are more stringent on the services. I mean, they will still provide you the service that you need, but there's more people looking over it to see, do you really need this service? Can I end it now? So you will feel, sometimes with Advantage plans, you feel a little bit more pressured just by their strict criteria. But both have its, benefits and things. So.
Thank you.
Okay, go ahead.
Yeah, sorry, I have a quick question. Earlier I saw those like rating from the PowerPoint slides, like 4-star, 5-star.
Mm-hmm.
Who gave those initial ratings? Who provided those ratings?
So they're done by the state surveyors. So every state have their state employees who are hired by the government who surveys these long-term care facilities. And every state have different laws on how the states are surveyed. There's a federal guidance and there's state guidance. So yeah, they're the government state surveyors.
Okay,
specifically for long-term care facilities.
Thank you.
So there's another question is, what are the most important things to consider when deciding on a living arrangement or elder care services?
It's a great question. I think first you need to think about, do you want your loved ones to live at home, like aging in place? Or do you think they would like to live in more of a community setting? I think that's the first thing to think about. The second thing is, how much help do they need? Like how bad is their medical problems? How frail they are? Like in the pictures I showed in the beginning of the slides, like there's different levels of health needs. Like, are they bedbound? Do they need 24-hour care? Or are they're on the walker and they may be a little bit, unsteady at times, but they can get around the house. It's things like that really makes a difference in where can they go and how much service they'll need. So, but definitely home or more of a community. Like, do they even want to live in a community? Like, a lot of adults don't. And then try to think about resource. If they don't want to go to a facility, then what are the resources you can get for them to stay at home?
I see. We have another question online. Say, can you provide some practical tips on what to look for in deciding on caregiving assistant? And what are the key qualities for good in-home care assistant and assisted living? What are things to avoid?
Okay, another great question. Honestly, I think there are so much different variety of different services, the home care services available out there. You can look up, you can look up the reviews and ratings online. You can talk to other people who may have gotten their services in the past, just by word of mouth to see how they are. In terms of key qualities, I think first making sure make sure first that they're licensed, programs licensed home care agencies. They're getting, the staff is licensed, whether they're licensed as certified nursing assistants or certified nurse. They have to have some key like training license to be able to do this. And I think the other thing is really like compassion for the elderly and having some empathy for them. When they're coming to your home and taking care of the elderly, are they patient with your family? Are they, or they're not very patient, they just want to get whatever they need to be done and leave? Or are they able to just kind of spend a little bit more time with your loved ones? I think those are kind of key qualities to think about. And you can get, even within the same home care agency, you can get many different types of people that comes to help you. And so you may have bad experience with one person, and then you can ask the agency to switch, that you don't want to, use that person again, and they can give you someone else. I just see so much different variety of people that is really hard to say, like, who is good. But once you find the good ones, then you'll know, the ones who are more compassionate, more empathetic. Things to avoid. I think generally, yeah, like those people who, unfortunately, there are people out there, who don't disrespect the elderly, who works in the caregiving industry, but they're so burned out that they're just so exhausted, and they can become very kind of disrespectful and brash with you. They're not always, being aware of the safety of the older resident. So those are the people kind of to avoid.
Okay. Another question we have is, what happened to someone who exhausted, what is that? Who exhausted the money for nursing home?
Yeah, so generally that actually happens a lot to a lot of older adults, because nursing homes are so expensive. You guys see the cost, like $4,000, $5,000 a month. If they spend down their assets, they used up their money for nursing homes, they become eligible for Medicaid assistance. And so usually the family member or the patient themselves, they will apply for Medicaid, and they will, generally, if they spend down their assets, they will be eligible for Medicaid. And Medicaid will pay for all of their nursing home care.
So on the same line is that if the person exhausts while in the nursing home, and what happened in interim when they apply for the Medicaid? Do they need to be out of it first before they come in, or they can stay there? And
they can stay there.
Okay.
Yeah. One thing to know about nursing homes is we are not really allowed to kick out older adults. Imagine what would be on the news if a nursing home kicked out their older adults on the street. No, it would not happen. They don't do that. It will probably just accumulate in bills until family members to be able to pay it, or the Medicaid approval comes.
I see.
But in the meantime, though, like whatever the older adults getting in their like Social Security and stuff, all of that actually would go to the nursing home though, to pay for their meals and facilities fees and stuff.
I see. What is the option for insurance if the elder doesn't qualify for Medicare?
So you can get regular insurance that would mostly cover, from your medications, your hospitalizations. More specifically for long-term care, like nursing homes or rehabs, you may need to get like long-term care insurance, which is a different type of insurance than normal medical insurance. But I would be very careful with long-term care insurance actually, because they can be very specific and they can exclude a lot of things. So you may think that you're all set for long-term care when you get the long-term care insurance, and then find out when you really need it that it doesn't actually cover a lot of things. So just be very careful if you're thinking about looking into that.
But actually for long-term care, isn't it kind of too late then when they start to need it? They're kind of at the age where insurance might not even accept them.
Yeah, that's the other issue too. It's so hard to predict whether you will be needing long-term care or how much long-term care you need. And yeah, by the time when they already become disabled, and then yeah, they might not even take them. So it's very tricky.
Right. Another question is, what do you think about home caring? Like someone rent out the house and one room having 2 or more seniors?
Home caring, someone around the house. So I think that's more like a personal care home. So if you have 3 or less residents, you don't really need to get a license for like a personal care home. But if you have more than 3, then you will need to get a license from Texas State. I think just the quality of it may be very variable. It can be very good, or it can be not very good because they're not regulated. So I think it's really, it's really hard to say whether it's good or not. Maybe if you have like a friend or someone you know that lived there and really liked it and think it's great, then great, go for it. But again, for unlicensed programs, you also want to be careful, because if something happens, then they may not want to take liability. Like, if your older adult falls, or God forbid something happens while they are in the personal care home and they're not licensed, they're not insured, and you think it's because of the staff's fault or something happened, then you can't really, they won't take responsibility. You can't really sue them. So you just have to be careful with that a little bit.
So I just want to kind of like trying to understand the home care. Actually, if a person opened their home for home caring, basically that person take care of the patient, right? Whoever the tenants are. So is this person actually, I mean, does this person need to hire like a nurse, a home health care, or is it just expecting that this is just to providing the service as like meals and hygiene and so forth, but not really nursing care?
Yeah, no, generally personal care homes don't provide nursing level of care. So as I said, a lot of them are owned by home care nurses who knows how things are done. It also depends on, how sick the people who live in that personal care home is. So they're generally, if they just are relatively healthy, they just need someone to cook for them. That may be fine. You don't really need a home care nurse. A lot of the personal care homes don't have like a full-time staff, like home care nursing all the time. And for specific training for caregiving, I mean, the certified nursing assistant, they have a little bit more training on, transferring techniques, cleaning, kind of different ways to clean, or, continence care. They do a little bit more training on those. So a lot of personal care homes hire the certified nursing assistant to do that. If you do it yourself, I mean, sure, you can always learn how to do it. It's not that hard, but the CNAs, they are trained. There's programs to train them to do it too.
Okay, this is a question, but I think I know the answer, but I just want you to just go ahead and answer it. Does Dr. Chai accept new patients? Not in Houston, right?
I do accept new patients if you're in Baltimore. My facility do take new patients, but I go to facilities in Baltimore. So I imagine if you're not there.
Okay, can you give specific example of exception cacho where long-term care insurance can deny you claims for some expenses you think will be covered?
So I don't have as much experience with long-term care insurance. I have heard of stories of my patients who they thought their rehab stay like beyond the Medicare cover days. Like they used up all their Medicare cover rehab days, and they wanted their long-term care insurance to cover more of their rehab days. And then their long-term care insurance said, no, they do not cover that. So it just things like that, that if you read in the fine print, you know, then you think, oh, they should definitely be covered rehab, but they don't. So there's just little surprises that kind of came up. And again, like there's so many different long-term care insurance plans out there, but you have to be really be careful to read the fine print.
Yeah, I do agree. And actually, before you buy, you might want to just check all the area that you are, you know, like be concerned with before you even purchase the insurance. Because sometimes the insurance agent might not even have thought of mentioning certain thing that maybe it's something that you care for. So you have to really go there with questions and exactly what you really want to purchase.
Yeah.
Not all long-term care is equal.
Yeah. And the other caveat is the long-term care insurance does not cover for assisted living. So a lot of times when people need kind of facility level care, they don't like nursing home. They want to go to a really nice and new assisted living, but long-term care insurance doesn't cover that. So that's something to think about too.
Right. Okay, the next question is, how are nursing home equipped, like an ER with a diagnostic facility, treatment facilities, or do some more acute patients or some in emergency situation get sent back to the hospital for care? Does that mean a patient goes back on the wait list to be readmitted to the nursing home?
Yeah, those are great questions. A lot of people don't know how nursing home is equipped, so I'm glad you brought it up. So nursing homes generally, they don't have an ER right there. They do have medications available, but sometimes they don't have like all of the medications. It's not like they have a pharmacy on site. Generally, the medications are delivered from a pharmacy to that nursing home like several times a day. But sometimes that's why sometimes it's a delay in medications because the pharmacy just hasn't delivered the medications yet. Generally, they do supply though like their own stock of emergency medication supplies, like emergency epinephrine pens for anaphylaxis, allergies, things like that. They do have some emergency medications available, but they don't have a full pharmacy on stock, and they don't have things like CT scans that are right there. That you can just do a quick CT scan. They have to send to a nearby ER for that. They can have labs done. So they have nurses that actually goes to, usually part of a hospital system or like a different private lab that comes to the facility to draw labs that the doctors want. They can run a variety of different labs, many labs. And they can also get like x-rays or EKGs that can be done, or ultrasound that can be done in the facility themselves. But for something more than that, like again, CT scans, MRIs, if you think the patient needs like an urgent CT scan, they will need to go to the hospital. And yes, if there's an emergency situation, like the patient becomes more acutely ill and they're not able to manage the patient in the facility, then yes, they will send them back to the hospital for care. And they're required to actually. And does the patient goes back on waiting list? Yeah. So the patient, when they're in the hospital and they're already living in the nursing home before as a long-term care resident, generally the nursing home does reserve their beds for them. They do a bed hold generally for them to be able to return back to the same room in the same bed.
So usually how long do they hold the bed?
It can be up to 30 days, depending on the facility. Different facilities are different. Generally, if the patient's been living there for a long time, even if they've been gone for longer than 30 days, they can still be put back on like a priority waiting list to go back to that facility. The facility will also kind of check in with the hospital and with the family to see how the patient is doing, to see if they need to continue to hold the bed for them.
So another question is for nursing home, do they have doctors on site, or is just the doctor would just come and visit and make their round and then just leave?
So it really depends. So a lot of times before the pandemic, the doctors used to stay in the facilities more, and sometimes they round and then they stay there to write their notes. After the pandemic though, more doctors are just kind of wanting to leave or write their notes at home. So it really depends on the facility. And then there was one question about consultants. Yeah, there are some consultants that comes to the facilities as well. And the specifics that is really dependent on the facility. The facility generally have contracts with different consultants. They almost always have one for mental health, for psychiatry services and psychology services that comes because there's so much mental health issues among the older adults in the facilities. Sometimes they can also have like urologists, nephrologists if they have dialysis services. So they can have different consultants that come, but it's really dependent on the facility and their contracts as providers.
Mm. So another question is that for the home health aid, does that include bathing?
Mm-hmm. Yeah. Yeah, the home health aides are the ones who help us kind of the daily tasks like grooming, bathing, toileting. But I mean, there are some certain home health aides, maybe they don't want to do bathing. It is a little bit more work sometimes. And also if you need like 2 people to do the bathing, like some older adults there, you know, need a little bit more assistance, like one person can't do it alone. Like then the home health care agency can say they're not able to provide that level of care, or maybe a family caregiver need to be there at the same time as a home care agency aide to be able to give the bath. So that will be reasonable if you think about it. Sometimes they can't send 2 home health aides just to do a bath.
I see.
You could ask them though to do like just kind of basic cleaning, like without getting in the shower, just kind of cleaning the body and things.
There's also a question online. Are there consultants one can meet to discuss the specifics of one's elder care needs and what's available?
Yeah, so I kind of addressed this question earlier. So it really depends on the facility and what contracts they have with different consultant specialists. I would say in general, facilities do like to have consultants because that is like a marketing strategy for them too, for knowing that, you know, they provide all these different specialists that come to their facilities. So that would be a good question for you to ask if you're looking into different rehab or nursing homes, like, you know, to ask them how many different types of consultants come to your facility and how often do they come? It's a great question.
Well, I actually wanted to also ask about, you know, what if your parents are not in a facility and they're just aging and various situations come up and we're just like not knowledgeable about what's available, what they should have. I mean, you're very knowledgeable. And it's like, are there people like you that a family could like meet with, you know, even like over Zoom or something where we can just kind of discuss like, here is where we're at. And, you know, what can my parents, you know, what facilities or what, I feel like we're reinventing the wheel. Like we don't really know. And there's just so much information out there and, you know, we just don't want to reinvent the wheel. And is there somebody knowledgeable like you? Like, can we pay you for a 2-hour consultation or what?
There are geriatricians here in Houston. There are geriatric clinics as part of Baylor College of Medicine. There's also geriatric clinics through UT Houston, through Memorial Hermann Systems. Sometimes they do house calls as well, where they come to your home for assessments. There are also geriatric, like private practice, concierge practice that can be a little bit more tailored geriatric services. But any geriatricians should know about especially the resources in their community. There's also social workers that are part of these geriatric clinics that will be more familiar with specific resources in that community. The other thing, there's also a case manager as well. The case managers are like similar to social work. They're more familiar with kind of the local resources. The area agency on aging, that website I showed you guys in my slides, I can go back to that. That's a great nonprofit. It's nationwide, but they have local chapters. So for the Harris County one, sorry, next slide, the Harris County one, you can always call them and ask them for a list of resources and see if they do, sessions where they can go over the resources with you. But they're great people, and they're the ones connecting the older adults and caregivers with resources.
How about Fort Wayne County?
Huh?
Fort Wayne County. You only mentioned Harris.
Oh, Fort Bend. Yeah. So the different there should be one in Fort Bend too. You can just on the elder care locator website, you can just enter your zip code to see if you can find a local agency on aging. Yeah, this is the area agency on aging. It's actually they're getting paid by the government, but there's like usually nonprofits, but the government actually pays them to provide these services for seniors. So they're available out there.
Can you show the previous page again,
Yeah,
please?
yeah, elder care locator website.
Dr. Kai, there's another person in the talk that her name is what now?
Melody?
Yeah, so would Melody be some, will be assessing this kind of questions like these people have?
Oh, Melody, maybe she is kind of retired now. And I know that she worked with hospice more, like different hospice agencies.
Mhm.
She may be more familiar than me for local resources.
Right, so she probably can point these people
She may be, yeah.
to where to go. And I just want to ask you also a question. When my mom goes through dementia, I think the thing that shocked me the most was when I was told, now I did do a little research before I asked this question. That is, everybody think of dementia as memory lost and all that. But actually, to me at the time, it was most terrifying was, it can make the person forget how to walk, forget how to swallow. And these kind of things that is physically, hurting the person, that really shocked me the most, because most people know it's memory loss, but then they didn't know it can affect them physically. Is it true?
Yeah. When dementia progresses, they can lose some of their basic kind of thinking and reflexes you would think for like eating, swallowing. They forget how to swallow safely. And yeah, definitely high risk for aspirating because of that. And then in terms of walking and things, there are certain, you don't really think about it when you walk, but there's a lot of muscle coordination and balance. And so sometimes, yeah, they may forget how to, use a walker or how to do it safely.
Right.
More in advanced cases, yeah.
Right. For the caregiver, they really need to know that to be aware. Thank you so much.
Mm-hmm.
Okay, if nobody have any other question, would you please help us to do these surveys? This will really help us, especially the Family Life Ministry, as we assess and see what are the needs that our congregation would like to, for us to address. But particularly, we want to also see whether this has been helpful to you, to me particularly, even though my parents have passed away. All the information that I have got since yesterday has been very helpful. And so we really appreciate you to take a quick survey and to give us some feedback. And then after that, then we will end this session, and in a few minutes, we will have a next session, which is kind of like a repeat of the workshop of this morning by social worker Melody Lin. And but this time it's going to be in English. If you want to attend again, if you have attended the Chinese one, but I want to attend the English one, most likely the questions are going to be different because it's going to be a different group of people that will be attending. So invite you to just stay. You don't have to just exit, but just stay behind because it's going to be the same link. And with that, we just want to thank you, Dr. Chai, again, for all of the information that she has shared with us. It's been very informative and great for a great participation as well. A lot of good questions that we can learn from another. Thank you.
Yeah, definitely. I'm sorry I haven't been able to share as much about Houston resources as I'm not practicing here anymore, but definitely reach out to your local area agency on aging, and there will be very helpful people there that can hopefully guide you more on this process.
Yes, thank you.
Dr. Kai, is it possible if you could send me your PowerPoint? I could
Yes.
post it in the church in the church website. So there were a lot of really good information. So we'll get that from her, and you could check out our website at the church under Family Life, and you could get more of this detail information for yourself.
Yeah, definitely.